Good afternoon. My name is Bonnie Brossart, and I am the CEO of the Health Quality Council. And thank you for giving me the opportunity to spend a little bit of time with you to talk about our rural and remote population in Saskatchewan.
Let me start with a very quick primer on the province of Saskatchewan. Saskatchewan is a very large province geographically. We cover approximately 650,000 square kilometers. And to put that into context for our American counterparts, that would be the equivalent of the states of California and Minnesota. Or transatlantically, the geography of Saskatchewan is the same as having 3 United Kingdoms. Needless to say, the population density is very sparse, and particularly when you look at the top part of the province, those light 3 green shaded areas of the map to the right of the text, that there is very, very few people living in that part of the province. The geography of the Northern Regional Health Authorities cover 46% of the province, but only 3.5% of the total population lives there. Stats Canada defines rural and remote areas within a population concentration of less than 1,000 and a population density of up to 400 people per square kilometer. Based on this definition, approximately 36% of Saskatchewan residents live in rural and remote areas. This is significantly higher than the Canadian average of 20% and more than both neighboring provinces of Alberta and Manitoba. Other facts regarding Saskatchewan's rural and remote population, which impacts health and health services, include Saskatchewan's total rural population has declined by about 4% between 1996 and 2001, and the farm population dropped about 15% during that same time frame. When we look at the face of rural and remote populations in Saskatchewan and the health of those populations, we must look at the First Nation or Aboriginal people that live in this province. In 2001, our population of people with First Nations descent was approximately 15% of the total population, and that number has grown considerably over time. Not only is it the fastest growing population in Canada, it is the same in Saskatchewan, and it is also a very young population. Particularly in those northern regional health authorities, again, those 3 light green shapes in the map beside the text, we see a high concentration of First Nation and Métis population. Anywhere from 80 to 95% of the population in those health regions are Aboriginal, and more than a third are under 20 years of age. What we're seeing with our Aboriginal populations are great health disparities. There is an increasing incidence of chronic disease, including diabetes and cardiovascular disease. We see Canadian-born First Nations and Métis account for the vast majority of incident cases of tuberculosis. Northern Saskatchewan, in fact, has one of the highest rates of substance abuse in a province that has the highest rate of alcohol dependence and alcohol abuse in the country. With 15% of the total population over the age of 65, Saskatchewan has the largest proportion of seniors in Canada. 47% of them live in rural areas. This does introduce challenges for health delivery and the receipt of health services. What we are starting to see, or have seen for a number of years, is not only is access a key issue for these populations, but how to manage existing diseases and multiple chronic diseases. By 2031, we anticipate for the province of Saskatchewan that 1 in 4 people will be 65 years or older. And in fact, the Saskatoon Health Region, which is in the center of the province, estimates that within 20 years, the population between 65 and 75 years is expected to increase by 105%. This next slide describes at a very high level some of the very common health realities in rural and remote areas. What we see in Saskatchewan is certainly, given the high prevalence of the elderly and First Nations population, a big need or a great need for chronic disease management and prevention programs, and access to services like these is challenging many times. We see challenges with regards to access, and certainly what we've seen historically is hospitalization rates for preventable conditions remains high in rural and remote areas. We also saw recently that rural seniors are more likely to receive high-risk, potentially avoidable medications, so a key quality issue for people living in rural and remote areas. So these populations, these geographic areas, present some unique and pressing challenges for healthcare providers and decision makers. Recently in Saskatchewan, we undertook a patient first review, a first of its kind review of the healthcare system in the province. And what made it so unique is that it focused on hearing the voice of the people that we serve, the patients, the residents, the clients who receive health services in Saskatchewan. What I'm trying to convey in this slide is to demonstrate the vast geography that we experience, whether it's in the southern part of the province, the middle part of the province, or the very northern part of the province, and what those distances mean in terms of delivering patient-centered care. Let me offer you one of the quotes that was generated out of the Patient First Review to give you a bit of the voice of the people who live in rural and remote areas. In our small community, we have 3 patients who need dialysis 3 times a week. The nearest town has a satellite dialysis unit, but it is full. Our 3 patients leave home at 6 or 6:30 in the morning, travel over a long, bumpy section of gravel highway, which is really hard on the body, and arrive in Saskatoon at about noon. When they are finished, their treatments around 5 p.m., we stop to have some supper. Then we head home and get back to our community around 11:30 p.m. or midnight. That's a quote from a medical taxi driver, and this is a trip that typically happens 3 times a week. So this next slide just offers a couple of more quotes from the people that were consulted during the course of the Patient First Review. And again, I really feel that they speak to the experience of people living in rural and remote Saskatchewan. And as it's important for us as health services researchers, decision makers, or healthcare providers, it's not just the face of rural people that we need to understand, it's their voices and their experiences with the health system. As a result of these conversations, the recommendations that were formed out of the Patient First Review and presented to government in October 2009 recommended that the health system develop a comprehensive and innovative strategy for rural and remote service delivery. We hope to see in the months and years ahead improved access to primary health, diagnostic and specialist services. We hope to see the cost burden of emergency transportation, including interfacility transfers, be reduced. And we hope to see a range of supports for people who must obtain their health services from away from their home communities improve compared to the current realities. So I'm hopeful that the recommendations that have come out of the Patient First Review offers a challenge to those working in the health system to put their energy and their efforts together to ultimately deliver patient-centered care for people living in rural and remote areas and ultimately improve the health of those individuals.
So I'm hopeful in the short period of time that I have given you an informative overview of the voice and the face of people living in rural and remote areas of the province of Saskatchewan. And by doing so, I have inspired you as health services researchers to think about the research and the knowledge that you can contribute to people working in the system, to those making policy decisions about how we collectively deliver patient-centered, family-centered care to people living in rural and remote communities. I wish you all the best for your conference. Thank you for having me.